Happy Migraine Awareness Month, everyone. Now, I don't know about you, but if you're like me, then the hardest decision is always when to go to hospital with a migraine attack. It could be that you can't think clearly. It could be that you don't think it's safe for you to drive there. So to help me answer the very important question of when do you need to call an ambulance, I've got a paramedic because they're useful people. Buck Reed is the New South Wales chair of the Australasian College of Paramedicine, and he's also an associate lecturer in paramedicine at Western Sydney University. Thanks for joining us, Buck.
It's my pleasure.
It's always a pleasure to talk to you. All right, let's get straight to it. When do you call an ambulance?
So there's a couple of reasons when it might be appropriate to call an ambulance. First of all, if you think you need to go to hospital and you don't think it's safe for you to transport yourself, so if you don't think it's safe for you to drive, or your migraine is causing issues with your vision or your hearing or your coordination, and it's just not tenable to get in the car and drive yourself. Also, if your migraine's doing something that it doesn't normally do. So if there's a new symptom or it's a particularly challenging migraine attack, something that you don't think you can manage yourself, then that's an appropriate time to call an ambulance. People are often a really good judge of their own migraines. They have a sense of what they can handle and what they can't handle. So I'd often say to people, be guided by kind of how you're feeling down in your gut. You know, are you more frightened than normal? Are you feeling something's different? Those sorts of sensations are often a good guide to use. So essentially, if you're thinking, should I call an ambulance? Then there's a reasonable chance that you probably should.
That's a pretty good kind of yardstick there. Obviously, this is more tricky for those who have stroke-like symptoms because anybody else around somebody that has hemiplegic migraine, that is mid-hemiplegic migraine, like myself, you're welcome to go and check out my Instagram if you want to see what it looks like. There's plenty of photos. It looks like a stroke to other people, and they may be tempted to call an ambulance even though the person with migraine is saying, no, I'm fine. What advice would you give to somebody, a loved one, for example, that's looking at somebody with migraine with, say, a droopy face or they can't speak properly?
Well, look, I think it's really important that people let those around them know what their migraine symptoms are so that they know what's normal and what's not normal. Now, the worst case scenario is someone will call an ambulance, they'll see the hemiplegia, they'll go to the hospital and they'll work it out there. And we know that's inconvenient, but that is at least safe. Hopefully, a better outcome is that people are aware of the symptoms and, you know, either the patient or the people around them can explain to the paramedics, you know, the nature of the migraine. You know, as you guys know, migraines come in so many different sizes and shapes that it's often difficult, you know, to work out what's going on. And it's also especially difficult for paramedics because we're encountering people for the first time. So in a very short time frame, we have to work out, you know, what's normal and what's not normal.
Mm-hmm. All right. So we've made the decision. We've called the paramedic. What do we do in the meantime?
So a really good thing to do is get ready for the paramedics to come. Turn on your front lights. If you have cars in the driveway, move those out of the way if there's someone there who can do that. Put any pets away. You know, open the front doors so that people can get in and find you, especially if you're by yourself. Try and make it easy for the paramedics to find you when they arrive. And another really good thing to do is get together any medications or any doctor's notes or things like that that will help the paramedics understand quickly what's going on. So one of the first things we'll ask you, for example, is what medications do you take? So if you have all your medications together, it's really easy for us to see what medications you're taking. And even if you're not that able to tell us what's going on because of your migraine symptoms, then often paramedics can kind of reverse engineer stuff from the medications that you have.
Awesome. Great tip. One of the things that the more hardened warriors who go to hospital often do as well that you might want to consider if you're a particularly anxious person or if you do lose the ability to speak is have a note on your phone that has all of your medications, what your diagnosis is and who your treating specialist is, and you can just show that to the paramedic. All right. What situation would it not be appropriate to call an ambulance?
You know, situations where people are safe and stable and they have other options for getting to hospital. If it is safe for people to get in a car and there's someone who can drive them, then that's, you know, a good option. Certainly if you have symptoms that you can manage yourself, you know, think about do I just need some more resources? Do I just need somebody in my family who knows what's going on to sit with me and reassure me? Because often people call ambulances because they're frightened or they're unsettled. I can imagine that going through migraine attacks is a particularly unsettling experience. So there's a lot of anxiety as well as the physical pain and the other symptoms. But really, paramedics are there to help people and to guide them and to help them navigate the healthcare system. Now, the paramedic doesn't necessarily have to take you to hospital. The paramedic may actually get there and assess you and say, I understand that you're having a really bad time. Do you have a good relationship with your GP? And if your GP is close, they might ring your GP and organize an impromptu GP appointment. So paramedics are becoming increasingly sophisticated about the options they have for managing people, rather than just picking them up and taking them to hospital. The other really important thing is letting paramedics know sort of what your triggers are and what makes you more or less comfortable, because we know that EDs are often busy places with lots of loud noises and bright lights and things like that. So
otherwise known as the worst possible environment for somebody to be with from the migraine attack.
Yeah, absolutely. So make sure that the paramedics know that that's a problem, because sometimes they can look at options like, well, maybe we'll not drag you into the ED straight away. We'll go in and speak to the staff and see if we can move you straight into some place that's a little bit quieter. We also have GPs that do home visits. So the paramedics might say, well, look, maybe you just need a bit of breakthrough pain relief, and we can get one of the sort of GP locum services to come down and provide that for you. And they can coordinate that as well. So there's a number of different options that the paramedics can instigate for you to manage your migraine symptoms, depending on what's going on.
Fair enough. That's all great tips. Thank you so much for making the time, Buck.
It's my pleasure.